Hi, my name is Lauren Glauberg, and I chose to focus my action plan on enhancing the collaboration of Eastern and Western medicine for IVF in order to provide a more well-rounded and effective fertility treatment plan. The plan will focus on effective communication, education, integration, and patient-centered care. At many IVF clinics, acupuncture is offered, but typically only right before and right after the transfer, and patients are rarely informed by their endocrinologists and their staff of the potential benefits of beginning treatment at least 3 months in advance in order to prepare for the IVF cycle to help with such things as hormonal imbalance, stress management, cycle regulation, blood flow to the reproductive organs, egg quality, and ovarian function, and also overall well-being and stress reduction. And by combining the strengths of Eastern and Western medicine in a coordinated and patient-centered manner, a more well-rounded and effective fertility treatment can be created that addresses the physical, emotional, and psychological aspects of the IVF journey, which all can be very complicated. So IVF clinics can be overly standardized, which also reflects a common trend in modern healthcare, and the conversation surrounding standardization in healthcare is ongoing. And finding the right balance between consistency and personalized care can remain a challenge that IVF clinics, along with other medical institutions, continue to navigate. There are certainly advantages of standardized care, including efficiency. Standardized processes can help streamline operations, make it easier for clinics to manage patient flow and resources effectively. There's quality control. Standardization helps maintain a certain quality level by following established best practices and evidence-based guidelines. And also predictability. Both patients and healthcare professionals can have a clear understanding of what to expect, minimizing surprises during the treatment processes. But there's also a lot of disadvantages, including patients have lack of personalization because patients have unique needs, and standardized protocols might not adequately address individual factors that can impact treatment success. Also, there's limited flexibility and in treatment plans, and it typically is a one-size-fits-all approach, and not all patients fit neatly into these standardized treatments. There tends to be patient dissatisfaction because patients might not feel like they're receiving personalized care, leading to dissatisfaction, and which can also lead to a lot of stress. And there's also missed opportunities for integrated care. Standardized clinics might not easily accommodate integrative approaches like acupuncture and nutritional counseling. So the integration of complementary therapies like acupuncture can certainly help address some of these limitations of standardization by providing a more holistic approach to patient care. So when creating my action plan, one of the challenges I faced was finding reliable research studies. Research on the potential benefits of acupuncture in conjunction with IVF has gained attention in recent years. However, the task of finding reliable research on this topic can be quite challenging due to several factors that affect the quality and accessibility of pertinent studies. There's a relatively small number of studies, makes it difficult to draw comprehensive conclusions or establish evidence-based recommendations. Acupuncture and IVF are distinct medical systems with different methodologies and terminology, and integrating these approaches for research requires careful consideration of terminology, protocols, and treatment regimens. Also, acupuncture protocols can vary widely in terms of the number of sessions, points selected, and timing. Standardizing acupuncture treatments for research purposes while reflecting real-world practices can certainly be quite challenging. And also, acupuncture is often an individualized medicine, and adapting these personalized treatments to fit a research framework without losing their essence can be complex. So while there's emerging research on acupuncture and IVF, the quality and quantity of these studies can be limited. As an acupuncturist, we have to navigate a landscape where evidence might not be as extensive as in the Western medicine world. So if anyone does have good studies out there, I would love to get a hold of them and share them, when I speak with Western medicine doctors as well as patients. So in terms of an action plan, I'd first start off by researching the field of reproductive endocrinology, familiarizing myself with the common and most current fertility treatments, procedures, and terminology used by fertility clinics and reproductive endocrinologists. I'd also take CEU courses and try to find conferences related to infertility and fertility treatments to stay up to date on the latest advancements in the field. And then in terms of presenting evidence-based research, I'd compile a database of evidence-based research studies that highlight the positive impact on acupuncture on fertility outcomes. And then I develop communication strategies to effectively communicate with reproductive endocrinologists and clinics. This might include using professional language, being concise and respectful of their time, and clearly explaining the benefits of acupuncture in supporting fertility treatments. Also compiling a database of detailed records from my previous treatments and outcomes to share with reproductive endocrinologists and their staff to help demonstrate the effectiveness of acupuncture as a complementary therapy. And then in terms of continuing education for reproductive endocrinologists, I'd create informational materials, brochures, and presentations about acupuncture for IVF. As well as those that will address the unique needs and concerns of individuals seeking fertility treatments to be shared with these reproductive endocrinologists, and create educational sessions for clinics on the benefits of acupuncture in fertility treatments, and then also create materials and brochures to share with the patients that go to the fertility treatments or fertility clinics. So it's not just about the REs, it's also about educating the patients. And then I'd reach out to local fertility clinics and reproductive endocrinologists to introduce myself and express interest in possibly collaborating. And I know a lot of fertility clinics offer events and seminars and support groups, so I might get involved in those to connect and network with healthcare professionals involved in fertility care. I'd also establish a mutual referral system with local fertility clinics that do not necessarily offer acupuncture. And lastly, I'd organize joint workshops or seminars with acupuncturists and REs so that they can share their knowledge and expertise with each other. As far as action plan assessment, gathering relevant data, information, and measurable benchmarks is essential to assess the impact of the action plan and evaluate the success of the collaboration. And this might include tracking the number of integrated care patients, evaluating patient outcomes and satisfaction, and possibly measuring referral rates. I'll evaluate the frequency of meetings and determine if they are occurring regularly and at appropriate intervals, as well as if the meetings provide sufficient time for discussion, planning, and decision-making. I would also review meeting agendas to verify that they are well structured and focus on key topics and identify any communication barriers to determine if there are any gaps in the knowledge that has been shared. I would also examine the referral patterns and track the frequency and success of referrals and whether there are opportunities for further collaboration. And also, I would evaluate the outcomes of networking efforts and partnerships in order to expand the reach of a more collaborative care model. And then there's long-term follow-ups, which may involve gathering feedback from patients who have experienced a more integrated care approach to assess their level of satisfaction and whether they felt well-informed and supported throughout their fertility journey. This could involve speaking with patients, analyzing online reviews and testimonials, and social media engagement. I would also gather information regarding the efficacy of a more integrated care model and determine whether the specific needs and concerns of the fertility patients were met, and also gather regular feedback and have open communication amongst acupuncturists and reproductive endocrinologists and fertility clinics. This is essential in maintaining a successful partnership and provide the best possible care for patients. This action plan is an ongoing process and allows for continuous improvement and refinement of the collaborative care model. So as an acupuncturist, adopting integration as part of my clinical practice holds immense value in enhancing patient care and expanding my professional horizons. And using this process will help me set clear and specific goals for integrating my acupuncture practice with other healthcare modalities and professionals. It will encourage me to engage in continuous research and education, including conferences and workshops, in order to further my knowledge of other healthcare modalities and their roles in patient care. This process will also expand my network in order to build strong relationships and further my practice and facilitate further connections with other healthcare professionals. Engaging in open communication and mutual respect will certainly foster meaningful partnerships for the future. This process will also help me educate my patients about the value of integrative care and teach them how acupuncture can complement other treatments. And it will also empower them with knowledge about the benefits of a holistic approach, which will encourage their active participation in integrative treatment plans. So thank you for listening to my presentation, and I look forward to everyone's feedback.